let's distinguish between whether they're ethical in principle and then if they can be operationalized in practice. Most of us think that they're ethical in principle. If, in fact, you are immune once you've been infected and that immunity lasts for a while, call it a year or 2 years, then in principle, actually, immunity passports can be a good thing. They can allow people who've gotten the infection to take over jobs without spreading the virus. They could maybe visit and work in nursing homes without spreading it to older people. They could visit people who are sick and be with them if they unfortunately are dying. They could work in hospitals. There are a lot of advantages to it. They could travel without requiring 14 days of quarantine. And then you get to the WHO's position and issue, which is we don't know if they work. We don't know if you've gotten infected by coronavirus, whether in fact those antibodies you have actually protect you long term, how protective they are, could you still get reinfected. Until we know some of those questions, it would be premature to develop an immunity passport and to have people use them, because you don't know if they get antibodies and if those antibodies are protective, and then you might send them into a work situation and they will contract COVID or they could transmit COVID.
So then, given how much we still don't know about the virus and the antibodies, what do we know about the efficacy of having an immunity passport for COVID-19?
Nothing. We just don't know whether they would be helpful because we don't have the practical information about the antibodies.
And we know that obviously testing is still not easily available and accessible to everybody worldwide. So what regions or countries then might be the most early adopters for this concept, and why?
Well, countries might be interested in it for travel reasons. I think that's probably going to be the leading edge. So you've seen Britain say that there's a 14-day quarantine to anyone coming in. Well, the only way you could get around a 2-week quarantine, which is a very long time if you wanted to go to London, it would be showing that you've had the virus and you can't get it again and you can't spread it. That's what would be the advantage of an immunity that would be one advantage of an immunity passport. Another advantage, as I said, is that you could work in some situations where the chances of transmitting it to people are high, and those people are at high risk, like nursing homes.
So then give us an idea of the legal and economic challenges that policymakers will have to consider in order to try and even institute an immunity passport, and the procedures.
Well, I don't think these are really legal. I mean, the legal issue is, can you create something where it's not possible to hack it or fake it and, counterfeit or forge it? That I don't think is the fundamental issue. I think the fundamental issue is a scientific issue, which is it the case that someone who's been infected cannot get infected again and is immune from the virus again for at least a significant period of time, like a year? So it's a scientific question. The economic question is, if you can get an immunity passport, then they would actually probably be good from an economic standpoint for individuals, certainly, and for allowing the country to open up parts of the economy faster.
And you talked about the value of having an immunity passport. What about concerns about the false sense of safety that it might give?
Well, if it works, it won't be a false sense of safety. It only becomes a false sense of safety if we don't have the scientific data.
So basically, at this point, though, since we have so many unknowns, is there anything we can have in terms of alternatives to an immunity passport while policymakers are sort of figuring all this out and waiting for the science to catch up as well?
No, I think we have to adhere to physical distancing, wearing masks, and the other items that we know actually make a difference in reducing spread. We will have science. We will know, I think, shortly whether people who have been exposed can get the infection again, whether they have antibodies and those antibodies are protective. And that's going to be the pivotal information.